Welcome back. It's time for the hot sauce now, and we're, of course, continuing to go pink all week long in honor of Breast Cancer Awareness Month. We're kicking off right now with our partner for the week, Emily Beecher from Southtowns Radiology. We want to thank you guys once again for sponsoring this week and working on this project with us.
Hi, thanks for having me here. October is Breast Cancer Awareness Month, but this is something that we think about all year round. So it should be something that's people are cognizant of.
Absolutely. And of course, we're going to be bringing people important information all week long. I made a visit out to the Hamburg location last week, and it really does, just a quick visit to the office really drives home the importance of worrying about going pink all year long and not just in the month of October. So we're going to talk about some preventative steps today. These are easy things that women should just be aware of when they think of their breast health.
Yes, yes.
The first is know your risk level.
Talk to your family. This is something that people probably don't think to do very often, is talk to your family about what your breast cancer risk was in your family. Did your grandmother have it? Mother? It's different things like that that you need to consider, and genetics is a big part of that. So you want to kind of know what your family risk is, and a lot of people don't want to talk about that kind of thing.
I was going to say, it's got to be something that's can be hard to bring up with.
It could be a little hush-hush.
Relatives.
So maybe it's a good time to go home and talk with your family and discuss what's out there, and then you want to take that information to your healthcare provider and talk about what your personal risk is for breast cancer.
Now, do you have a lot of patients at Southtowns who maybe had no idea that this runs in their family?
Yes. Well, I mean, when we have a patient that comes in and gets a mammogram done, we ask them, what is your breast cancer risk? And I'm sure that as a lot of us go to the doctors, they'll ask you that question. And sometimes you're kind of like, I think that there was breast cancer on maybe my dad's.
Somewhere
or
along the line.
I know. So it's good to be very certain about that and know what your breast cancer risk in your family is.
All right, our next piece of information is know what's normal for you.
Right. You want to know your body, what looks and feels normal for you. And if you see any changes in that, you want to bring it up with your healthcare provider right away. If you're having mammograms done and maybe you're still a few months or weeks away from having that done and you notice a change, it might be a good idea to get it checked out sooner than that.
And I love what that last piece of information on the graphic said. It said normal is different for everybody.
Yes, it is. And the signs of breast cancer can be different for everyone, so you don't want to just go by the book necessarily. If you see a change in your health, if you see a change in the way your breast looks or feels, you should have it checked out.
And it just, again, drives home keeping communication lines open with you and your healthcare provider there. Right. Okay. And our last one, of course, is get screened.
Right. Screening mammograms begin at age 40 and go every year from that. A baseline can be taken at age 35. And prior to that, from age 20 up, you should have a clinical breast exam done by a professional. That's a good way for younger ladies to maybe start thinking about their breast health before they get to the age where they can have a mammogram.
All right, absolutely. Emily, we're going to be checking back in with you, of course, all week long. Tomorrow, we're going to really kind of delve into what the process of getting a mammogram at Southtowns is like.
Right.
So we're going to see more of that tomorrow. But in the meantime, if anyone has any questions on any of this, how can they get in touch with you guys?
Southtownsradiology.com has a lot of information on there, and it will tell you about the mammogram and tell you about the procedure so you can dispel some fears.
All right, yes, and of course we're going to check that out tomorrow on Winging It Goes Pink Week. Emily, thanks for coming in. Of course, we'll be in touch with you all week for Winging It Goes Pink.